Hi. Question I often hear is whether dietary cholesterol will have a negative effect on serum cholesterol, which is the cholesterol number you get back from the doctor when you've taken a blood test. And to answer that, I like to reference an expert. I found that this book, The Cure for Heart Disease by Dr. Dwight Lindell and Todd Nordstrom, to be an excellent reference if you want to have a greater understanding of what causes heart disease. Actually, he goes into how heart disease is formed or is the factors leading to heart disease in our bodies starting at a very early age. It's a great reference. I think everyone should read it personally. But what he talks about, I'll just tell you, I'll reference the doctor. Basically says that all of our cells can make cholesterol. Most of them are made in our liver. And healthy people maintain a relatively constant blood or serum cholesterol no matter how much cholesterol you eat. Now, take this in perspective. If the dietary recommendations are 300 milligrams, okay, and we have approximately 15 to 30,000 milligrams in our body at any one time, so you're talking about a dietary recommendation, daily intake of 1 to 2% of what we have in our whole bodies. What you eat is probably going to have a very small effect on how much is in your body. And it really, as he says, as you eat more, your body will produce less to meet its needs. If we consume more cholesterol through dietary sources, then our liver makes less cholesterol to even it out. Now you're saying, why is our body making cholesterol? Isn't it bad? Well, cholesterol makes up a lot of vital hormones in our body, like testosterone, estrogen. It helps us produce vitamin D. It coats our nerves. It's in our brain. We need it. It makes up 50% of the cell walls in our entire body. So it's a necessary nutrient. What we don't eat, our body will produce. So your total pool of cholesterol is not the same as your serum cholesterol or the cholesterol that's in your blood. Now, well then why is your blood cholesterol going up? He discusses that too. The pancreas produces insulin, as we all know, as a response to taking in sugars and starches. Now, the synthesis of cholesterol is actually controlled mostly by insulin. So high levels of insulin, as a result of taking in the sugars and starches, stimulate the production of cholesterol and disrupt a normal control or a balancing mechanism of the body. So basically, your serum cholesterol can be affected by your insulin levels, which is affected by your intake of sugars and starches. So, he had, out of concern for helping people not end up on his operating table, he opened a clinic to help them adjust their diet and cut off heart disease before it gets to that point. So in his clinic, the reduction of blood cholesterol, serum cholesterol, when we reduced consumption of sugars and starches was dramatic. The patients who followed the diet and took their supplements had their cholesterol and triglyceride levels return to normal. With many of these patients, they were able to discontinue both high cholesterol and diabetic medications. So you're seeing that regulating the sugars and starches affected their cholesterol levels and apparently was reducing their diabetic symptoms, so they could actually reduce the drugs they needed to regulate their blood sugar. And we're finding that sugar, starches, and insulin levels seem to be the causal factor for not just obesity, diabetes, but also straight up heart disease. So there's no conflict in reducing carbs, increasing fat intake in regards to disease. So once again, look for this book, The Cure for Heart Disease. It's a wealth of information. If you have any concern for heart disease, as you should, want to be knowledgeable, this is the book I recommend. There's a link below. Check it out. I think you're going to like it.